I'm Ranjit Borua, a research scholar, IAC Shibpur. My topic is mechanical surgeon, the future of modern medical science. Uh, Before start my presentation, this is my actually the contents, the introduction, modern medical science, the history of the robotic surgery, application, upcoming trend, and references. So I'm
Dada,
going
your slides are not changing.
not changing. Just a minute. Now is it? Now it's changing or not?
Yes, Dada, it is changing now.
I think full screen is not work. Okay. Now, before going to introduction, uh, we have to know about the three laws of robotics. The first law of robotics, actually, it is very much important for us, those who come from the basic engineering background to in medical, that means the interdisciplinary biomedical sector. So we have to know about the basic law of the robotics. The three law of robotics actually comes from in 1942 the Isaac Asimov. You already know about the name Isaac Asimov, and in last storytelling already we have heard the name. So he's one of the great books, the iRobots. From there, the three laws actually we discussed. The first law is a robot may not injure a human being or through inaction allow a human being to come to harm. Is the first law. The second law is a robot must obey the orders given it by human beings except where such orders would conflict with the first law. And the third law is a robot must protect its own existence as long as such protection does not conflict with the first and second law. So we easily can understand that the basic law of robotics actually a human can write or rewrite the program, and human can order any machines. Basically, the robots use the such type of machine which can less the effort of which can help to reduce the human effort. So regarding aspect of the use of robotics in different sector, in my case, and it's used in medical sector, especially in surgery. In medical robots, the last few decades rapidly growth. It is in globally in different kind of surgical procedures like orthopedic surgery or neurosurgery or remove PCNL, percussionary lithotripsy of to remove the kidney stone from kidney, or some kind of prosthetics or exoskeleton based application, or any less trauma or rehabilitation or capsule load are very much useful and effectively used in nowadays and for medical surgery cases. The key technology involved with the basic engineering and as well as the medical science. So whenever a particular area, the basic medical science and the engineering techniques and methods come together at the time, uh, biomedic robotic analysis is very much helpful for modern medicine and modern medical sciences. So now the for basic robotics science and advanced intelligence system involve of numerous type of applications and the effects that like as for engineering purpose, the force sensors of the position sensors, the actuator, visual sensors and control different kind of control algorithms. And in case of whenever we use in any kind of medical applications, that the surgery, especially MIS, minimum invasive surgery, or minimum surgery, pressure valve solution, tempering the skin. And also one of the most interesting thing is that the augmented AR and VR, augmented reality, is now a very much helpful us to make this kind of application in modern medicines and modern medical science. Whenever it is not possible to do for in situ like operations. So sometimes for trainer for upcoming surgeons, in biorobotics engineer like us and another of the surgeon medical surgeons, both we are involved for make or to analyze any particular human bodies or any organ special or any internal organ of complex architecture. They can easily can understand how much penetration, how much cutting force is required, or how the blood flow can we have to generate from particular organ to another organ. So all this can easily solve with this kind of applications. Now, minimum invasive surgery. Now we have to know the why. What is MIS? You already know the conventional surgery procedure. The C-section actually, the C-section done different kind of conventional surgery procedure in former cases like stone removed from gallbladder, or stone removed from kidney stone removed from ureter or your kidneys. But the thing is that whenever we use the conventional surgical process, so it's take a time to cure, and sometimes the patients and the pain is very much. So at that time, when problem will occur, so definitely problem means definitely there are some solution, and at least we try to make cure the solution. But at the time, medical science surgeons and the biological engineer both are make a conceptual of surgery, which is very much useful. That is named as minimally invasive surgery to make a small hole, and with the help of telescopic lens and other surgical instruments, robotic instrument, which can easily which can easily go for particular area which have to remove from internal spaces. So this is actually a minimum invasive surgery. So this minimum invasive surgery is very much useful nowadays. Later I will describe how it's help us. But now the most important thing is that the historical phenomena, how this kind of this robotics application is evolved. So initially, what's happened? The first generation stereotex robot is initially it was the prototype, but gradually the first generation, then second generation endoscopic robot is the MIS principle. Whenever the second generation endoscopic robotics concept occurred, at this time minimum invasive principle is very much useful for this kind of second generation endoscopic application. And and what will happen, the biomedicals and the biomaterial and biomedical sector at this time rapidly it can evolve its area. So what will happen whenever the third generation and the fourth generation micro robot, whenever third generation and fourth generation robot, this is very much interesting part. At the time, bio-inspired material, bio-inspired some instrument are occurs like that, tendon-driven, catheter-based application and concentric tube-based. So, catheter-based application-based sometimes the neuro brain surgery. So, external some fluid, that is the blood fluid, BBB junction. So, through there the blood which we have to remove from the particular areas. So, a catheter you replace there, and not only that, the some kind of colonoscopic cancer whenever it occurs. So at the time, if the medical surgeon required to remove the total lower part of the colon, so what will happen at the time, they use the polyvial like catheter use to help this kind of applications. Another thing is that uh, whenever the block of blood clot in our vein or any kind of our AC node or whatever maybe in our heart. So we use some kind of electromagnetic steering based application, and we use the navigation based technology and control panel operator. So all this kind help us a lot. So it can rapidly, I can say the word the renaissance of the micro robotics application for fourth generation and the fifth generation autonomous robot. So now the technology is still continuing going on. This is the medical robotics system for different decades. In 1987, the Neuromate actually initially they think about the medical robot they introduced for the medical surgery, and but initially it was too tough. So later the 5 years back, So what will happen? Not in 1987 to 1992, the robotics, the robot doc, the surgical system introduced, and gradually it will going on. And one of the most important thing is in 1999, the Vinci surgical system is actually applied hugely in not laparoscopic surgical operations, not only, and also it is used in our spinal cord based MIS surgical operation. And whenever the 1999, the Da Vinci surgical system occurred, at the time, rapidly motion-oriented, neuromuscular fiber tissue, regenerative oriented, sensitive oriented, and neuro-arm oriented, different kind of robotics application are introduced. And you can see in my timeline indicator, you can be 2001, 2003, and upcoming nowadays in 2019 to 2020. In now in present scenario, what will happen? Already major exoskeleton and monarch platform based robotic application are now very much useful for this kind of application. In my case, actually I'm a research scholar of ISC Pur, and a part of I'm not discussing here, but the thing is that minimum invasive surgical system robot, the major exoskeleton, already I've worked with this kind of application. Now I'm giving the five most important medical robot which can hugely affect on healthcare science. So first one is the Da Vinci Code, the Da Vinci surgical robot. Second one is the Genex germ zapping robot. The third one is the Paro therapeutic robot, and the fourth one is the cyber knife robot, and the fifth is the TUG. So the Vinci surgical robot is actually it we can say it a 14 DOF, the degrees of freedom. It can degrees of freedom means it can move or not. It's axial rotationally and linearly. Vinci code, the Vinci robot actually it's inspired by Leo da Vinci's imagine some kind of robotic hand. So here the 4 or 5 types of robotics arms are used, which are make up properly coding or with the algorithm. And what will happen? Each arm have some kind of special operative knife or instrument which can help to tear off finding telescopic lens, and also can drill, can also supply the supply the carbon dioxide and different kind of gases. And for another thing is that which can easily help to surgeon and biorobotics engineer for real-time operation theater. So this kind of Vinci code, the Vinci like surgical robot, very much useful nowadays in India. Also, later I will show some example. This is actually a Genex jump japping robot. We can say this is surgical robot, but it is actually robot of material handling type of robot. It can help to carry different surgical instrument like knife, like hot water, like different kind of medicines. So it can what will happen? The different kind of temperature and ultrasonic sensor having there. Whenever a particular base of, suppose I'm talking about remove kidney stone from kidney, left kidney for human. So what will happen? Initially it can be easily understand what is the young modulus or Poisson ratios of the upper skin. Then what will be the inner kidneys muscles young modulus or Poisson ratios. So whenever we biorobotics engineer create the algorithm regarding this kind of application based robotics channel or control panel. So what will happen? So at the time when we use to insert the needle inside the kidney, so at the time now suppose it have to require some kind of saline based water. So this kind of Genex robot, it can easily help to carry this kind of saline based water. So this actually I'm giving you a simple one type of example. Now it can use not only use in kidney stone remove, but it's also used in different kind of dental operation or operation of now spinal cord stretching, orthopedics like operation, etc. Now I'm coming to another interesting robot, that is a parotherapeutic robot. Actually, it is you look, this parotherapeutic robot actually a mimic a cute like of seal. So this it can help any patient for to recovering from his trauma or stresses. So this is actually we can say this is also a medical robot, but not a surgical robot. It can help the human a patient for particular dyspnea like disease or any kind of traumatic problem. So it can help us. Another thing is the cyber knife. Yes, this is very much useful now in surgical operation theaters room. So this robot have arranged with synchronous camera, X-ray sources, and linear accelerator and robotic arm. It is now nowadays is in our normal they are now in developing, because the problem is that some extra complex area which is very vital in organ. So sometime what will happen if they have to require the conventional surgical procedure, no have to require any kind of MIS. So this kind of robot at that time it not be used for particular this. This is actually I can say a disadvantage, but the research is continue going on. And another thing is that the control panel is also very much complex, because some kind patient and they don't want to they have to require a long time anesthetic. So this kind of robot actually can work. Their working time is 1 to 2 hours, but the long term anesthetic it is very much challenging work. Oh, another kind of robot actually are called the TUG robot. This is also you can say a vehicle movement robot, but this kind of robot also behave like as Gen X jumping robot. But the most interesting thing is that the robot can follow a permitting path, which can help the surgeon for carry the patient, they carry the monitors or surgical any like of instrument. So nowadays, this kind of robot is hugely used in different kind of hospital or nursing homes in India also. Now the question is coming that how is robotic surgery helpful? Yes, it's very much helpful because it can sort out your hospitalization time, reduce the blood loss and transfusion, reduce the discomfort and pain after surgical pain, and the faster recovery time and return to home and daily based routine activities. So this is actually very much useful of surgical robot nowadays in medical science. And another question is coming that is robotic surgery better than the regular surgery? This is actually this question is some I can say compared to traditional surgery or conventional surgery, at surgeon have to require skilled its colleague. A robot can be used as a colleague because robot has to be controlled by human. Human means it is also biorobotics engineer and surgeon's knowledge. So it can say that fully robotic robot can surgery any patient can make it gratefully or effortless, because yes you have to it has to be required medical science knowledge and the engineering knowledge, and what will be the performing the things. But now another thing I can add it, the most importance that is the published data in NIH, the 94 to 100%, near about ranging 94 to 100% successful case are documented last 2015 to now 2020. So this is actually a very good analysis. Now I am also analyzing the thing, the service robots and professional robot applications. You can find here the logistic robot and the robot public environment and professional and medical robots. Now there, I have used their application based area. So now medical robot their application is very less, because gradually it is in under it is the medical robot application based area. Logistic robot, that means the automatic vehicles or a robot application in public environment or professional cleaning. Um, I hope in 2022, 2020, 2022, upcoming 2030, the medical application of robotics will be increases, because now researchers are very much involved their research regarding the application of medical robots for particular surgery, or another thing is that the new MEMS based area. So I hope that this graph will increase. Now the service robot professional, there another study. There what is the main application based area? The service robot or professional uses. You can find the inspection for particular inspection, professional cleaning, field robot, and power human exoskeleton. As we can find here, the power with exoskeleton application of robot is very less, because this kind of robot totally attain the medical robots. So whenever the medical robot is not increasing for particular field of area of medicine or modern medical science, so definitely it will not be increases this kind of proper powered human based exoskeleton. Now the robotic markets segment, this is the key data from collected from iData Research, US. This data is actually regarding the 2050 to 2025. The market value we can easily understand. That is the green pure green base area is the MIS robotic system application. They are hugely growth up. And the thing is that the robotic based, I think, neurosurgery, catheter based surgery, so where we can find the robotic acid orthopedic surgeon and catheter and vascular based surgery, the market is very much reach higher to higher. So now what I'm talking about, it's my hope that the 2020 to 2013, the MIS based application of robotics will hugely increases nowadays. Now the thing is that robotics in Indian medical sector. So in Indian medical sector, first 1998, the Escort Heart Institute and Research Center, they used to fix a hole for patient heart. They use this kind of robotic arm. This robotic arm in 1998, actually in 1998 December, actually at that time the Vinci robot arm will occur. So they inspired this kind of the Vinci surgical robot. They use a single arm-based robot and which can help to hold in a particular patient. And 2015, IBM introduced a AI-based and cognitive power-based powered with both Watson. So they attach with Manipal Hospital, and they use a particular base of robotic application in medical sciences. Now, the cumulative average growth rate of this kind of application in India, robotic application, is 20% in 2017, and it will increase it last upcoming 5 days, because now 2021, in 2025 we can assume that it can hit the $350 million also. Now the Indian robotics market, we hope it will be Indian robotic assist surgical market is expected that rupees 26 billion in 2024. The data collected from the Times of India in September 2020. Now the thing is coming, the robotic solution provider in India, and now I'm talking is very less actually, because some few company are available for this kind of actually surgical robotics provider. That is the Osimov Robotics Private Limited. They provide engineering product solution, machine vision training, augmented virtual reality, navigation application, and they are robot used in minimal invasive and also healthcare based robot exoskeleton, very much useful for, and which is very much now you can find different kind of like Fortis or Genesis Life Hospital, they nursing home, they use this kind of robotic this application for their surgical operation. Another one is the intuitive surgical, is very much very famous for their the Vinci surgical system, and a laparoscopic system. They are very much useful for surgeries in across the world. And another one is the Strikers. It is US based company. Basically, they provide the orthopedics based and neurotechnology based, and some kind nowadays they use the spine and urological based. They are providing surgical robot. So it's our challenge to make this research in our India to develop, and already this kind of conventional this kind of robotic application is now that cost is minimized, because whenever rapidly research work is going on, and so definitely we can reduce the cost, and which can help our common peoples also. So this is actually a very great challenge for us as a researcher. Um, this is my references. Thank you. If you have any question, please ask.